Love it. I love it. So another question I get from patients sometimes that I think I'm curious to hear you talk about is this the idea of how much is good enough. I know there's debate about 250 million or 300 million. Kind of what's the ideal load if you're thinking about injecting someone with stem cells? What is the pros and cons, and where is that threshold that seems to be?
It's interesting. The debate, I think, rages on because you've got people with existing interests, right? If you have a clinic that's you set up overseas because you couldn't do certain things in the US, like growing the cells to huge numbers to make a large number actually affordable. So here you can do a large number, but it's going to cost you $100,000 if you are doing, like 100 million cells. But overseas, you can get it at $20,000, $30,000. So, but do you really need these expanded cells at that kind of high number? And what I did was I really wanted to answer that question because I've seen people using much less number of cells and getting incredible results. So, and there are people going overseas, getting huge number of cells, also getting incredible results. So what's going on? Do we need this large number of cells? And are they actually better? And from what I've seen is that more is not better. First of all, if you just use more of the same kind of cells, let's say just hypothetically, we're using expanded cells. The research have shown if you give 100 million versus 200 million versus 300 million, sometimes the lower dose actually work better. Not always, but sometimes. So the results are inconsistent, but there appears to be some kind of a Goldilocks zone that a certain range of the consensus maybe is if you use expanded cells, 100 to 200 million. If you use 300, it could be less effective. It could, cause the effectiveness to go down. But if you use unexpanded cells, what's interesting was there are research showing if you're using much less number of cells, but they're unexpanded, you could have stronger benefit than this huge number of expanded cells. And that's what's fascinating. And of course, so much research have shown, even with 24 hours of cell expansion, which means growing the cells in the culture medium, even 24 hours of growing, most of the times going overseas, they will grow the cells for days or even weeks to basically get a huge batch of cells. And then they parcel out a portion and give it to you, right? And they're not giving you the whole thing. They're giving you a portion, but they grew a lot. So all of a sudden their cost per batch is much less, right? They just grew a bunch of cells. The problem is that when you grew all those cells, a lot of those cells, one, they are no longer the original stem cells. Often they've differentiated. But let's not even talk about days to weeks of expansion. Even 24 hours of expansion have been shown to decrease the cell's ability to home in, so to find their way into the target tissue, and to engraft, to stay in local area. So if you can't find your way there and you can't stay, how are you going to help that area to repair, right? And then when you check on the efficacy, a lot of times when you have too many cells that are expanded, you end up having decreased efficacy. The cells start to change their genetic expressions, start to a lot of times secrete inflammatory molecules that can cause problems, and they can trigger rejection type of reactions. So that's why in overseas clinics, Tony Robbins talk about the cytokine storm. Okay. It's convenient to just put a label saying, oh, it's a cytokine storm. It's normal in cell therapy. No, I've never seen cytokine storm in native cells that we're using because we're not triggering the release of these inflammatory molecules, and we're not triggering the cells. We're not seeing any differentiation. So your body is not going to see receptors or surface proteins that are consistent with the donor, and you're not going to mount a rejection response. So these are important things. I think people need to understand, yes, you can go overseas. You may get good results, but you may get even better results and less side effects when you're in the US. Okay. So, but of course you need to find out the right practitioner. Not everybody's using the best products.
Yeah. So it sounds like what you're saying is when these expanded cells, you run the risk of both maybe decreased potency and an increased risk of, with that differentiation, more of a pro-inflammatory response.
Absolutely. And I've seen that in my patients who came to me after having received treatments from overseas, right? This is the same person, the same body. They get drastically different responses by taking expanded cells versus taking our unexpanded, less in number, but seems way better as far as clinical improvements.
Yeah.